So, good afternoon, ma'am. I hope you're doing well. To everybody who's watching our session today or will be viewing our session after today, we have with us Dr. Niharika Singh, who will be sharing with us her insights on the topic of understanding depression in children. Doctor, could you please introduce yourself again?
Okay, hello, Ojis. I'm Dr. Niharika. So I'm a neuropsychiatrist. Today we will be talking about depression in children. So let's get to the
Okay.
topic.
Thank you so much for the introduction, ma'am. We'll start with the conversation.
Sure.
So the first question, ma'am, is what are some distinguishing signs and symptoms of depression and anxiety in children, and how can parents and educators differentiate between the two?
All right. So basically, in children, as they grow, the symptoms and signs keep changing. They won't be what we actually see in adults, and in fact, it varies. The symptoms and sign varies in different age group of children. For example, in preschool children, the signs would be that they are not engaging in joyful playing. They are irritable and they are throwing a lot of temper tantrums and there's low frustration tolerance. They are getting very sensitive about small topics. So these would be some symptoms in preschool children. In school age children, it would be more of a somatic symptom. So they will be school refusal. They don't want to go to school. They're saying every day there is some new complaint, stomach ache, headache, and various other somatic symptoms. And in adolescence, the symptoms may vary, and it would be a little bit like adults. So they would complain of low mood and a lot of neurovegetative signs like feeling tired and not able to get up, not engaging in age appropriate activities like going out or playing or socializing. They would prefer to be alone. They would prefer to play video games over going out with friends and having low self-esteem, having loss of concentration. They're trying to read but they're not able to focus. So these would be few signs and symptoms that you would see in children, and these should be discussed and should be taken carefully. So, coming to the second part of your question, how parents and educators and other people can help identify these signs and symptoms. So, if a child was doing well and there is sudden deterioration in their academic performance, or if you feel that they're preferring to be alone at all times, they are not as outgoing as they used to be, or there are signs of self harm. So you may find signs of self harm in terms of there may be signs of bruises, there may be signs of cuts on the wrist. So these could also be some telltale signs that could point towards depression and anxiety. Along with that, I also feel that educators as well as parents should be aware about few common neurodevelopmental disorders, because these are very much comorbid with depression and anxiety. Sometimes they are the first sign before we come to the actual neurodevelopmental uh, before we actually identify the actual neurodevelopmental problem like ADHD or autism. So educators should understand what could be the signs of ADHD. The signs would be that they are not able to sit at one place, they can't wait for their term, they are very interruptive, they are bullying other children. So these are some signs that we should be identifying, and these could be a pointer towards ADHD. And if not taken seriously, these can lead to depression, low self-esteem, and anxiety. Likewise, autism can also be identified by parents as well as educators. So the signs would be that the child is not speaking despite being at age. So at least if the child is 2 years old and he's not speaking, he's just babbling. So that's a sign that he may have autism. And other signs like repetitive movements like waving and other self-stimulatory activities like they will be twirling, toe walking. So these are few symptoms that should be identified. Yeah.
Thank you so much for the insights, ma'am. So moving on to the next question, ma'am. What are some preventive measures that can be implemented by parents to avert the development of depression and anxiety in children?
So I think the when we talk about preventive measures, I would rather say what could be the risk factors which puts a child at risk for depression and anxiety. So if we are able to take care of it, we would be able to actually prevent depression and anxiety. So one very important thing is having a secure attachment. So a figure on which child can rely on. So we should the parents basically should not try to be overprotective of the children, but on the other hand, they should also not be dismissive about them. So what I'm trying to say is, having some lines and boundaries and discipline, but also being kind to children goes long way. Sometimes just having difficult temperament in the child. So temperament is something a child is born with. So even having that can lead to depression and anxiety in future. So even that can be taken care of by seeking help earlier. If you feel the child has difficult temperament and there is no problem, but still child is, the child has a lot of temper tantrums, or it's not, you're not able to manage the child. If that's happening, rather than being critical about it, try and seek a help on how to raise a child who has difficult temperament. Also, things like having stressful or traumatic experience, having experiences of child sexual abuse, maltreatment, physical abuse, bullying, these could also be few factors. So, the more friendly you are towards children, the more expressive they would be. They would be able to tell things which they may not tell you otherwise if you continue to be friendly with them. Look for signs, look for their drawings, what are the kind of drawings they are doing, what are they watching on mobile. So these would be few things which would tell you how a child is doing. So again, parenting style, like I mentioned, the parent should not be punitive, that is not being critical. There should be clear lines, and there should be discipline, there should be a regularity in their routine, there should be predictability in a parent's behavior. So you should not be unpredictable, that one day you are letting go with some kind of behavior, another day you are being very angry about the same behavior. So be predictable with children. And also interpersonal loss. So have losing somebody you're close to is always difficult for all of us. So even for children, when they're not able to process the whole thing, it takes some time for them to develop the concept of death and grief. So when they're very young, let's say 3 or 4 or 5 years old, they're not able to understand that it's irreversible. So losing somebody very close, like grandparents, can also lead to anxiety and depression. So sit down, talk to them, make them understand what has happened, what does it mean. So these would be few things. Again, I would say parental discord. This is last but very important factor. So having an environment at home which is warm and which is affectionate is very important. So if the parents are fighting all the time and they are aggressive towards each other, there is physical abuse in parents, that can also adversely affect the psyche of a children. So these would be few things that I would say is very important to help prevent depression and anxiety in children.
Thank you so much for the insights, ma'am. So the last question, ma'am, for today is going to be: in what ways can parents and educators collaborate to create a holistic support system for the children that are dealing with anxiety and depression?
So I think I've covered this briefly in my previous questions. So one thing would be knowing what it is, knowing what is depression and anxiety, understanding how this could be different in children as compared to adults. So this would be one important thing. Having knowledge of neurodevelopmental conditions, like I mentioned, ADHD and autism and intellectual developmental disability. So having an understanding of these things in both parents and educators would be important. And third would be being accommodative towards them. So once a child has been diagnosed, rather than stigmatizing the children, I've heard this from a lot of children actually. Nowadays, schools are actually taking an initiative and they do keep counselors at their school. But it is seen as a stigma even among children that this child goes to a counselor. So what was discussed? So how are you doing? And they make fun of this. So this thing also has to be dealt. How to normalize this in children? How to not stigmatize children? How to not label them? And be supportive and accommodative towards them is would be very helpful. So just giving an environment where you can let your feelings out, where you can be yourself, would be good enough.
Okay, thank you so much for the insights, ma'am. Those were all the questions I had for you today. Is there are there any final words that you'd like to convey to the audience before you leave?
I would just say that if you have a child and if you think there are problems and you have not been able to manage it, you should not hesitate to seek help, because the earlier the intervention is, the better the response is. So yeah, seek help if needed.
Okay. Thank you so much for your time, ma'am. Thank you so much for the insights. I'm pretty sure everybody who's been listening must have found this very helpful.
Thank you very much.
Thank you so much.